So medication errors have been recognized by Institute of Medicine to lead to not just poor quality of care, but increased burden on our financials toll as well. So it's been estimated that medication errors can cost about $3.5 billion to manage them. And about 40% of that is considered avoidable or preventable. So for that reason, Institute of Medicine actually in 2005 recognized that a sound medication management program could help prevent these errors from occurring. And that's what propagated Health Alliance Plan to start developing their medication therapy management program. What was interesting about it is there's actually very little data, especially back then, to understand what a medication management program should be, what's the best way to do it. It was also the benefit of that because we didn't have to follow what others did and we were able to create our own program. And one of our goals in that program was to continuously make sure the patient was our focus, and we wanted to identify what were the patient's needs and make sure that got incorporated. The medication errors that you see not only lead to poor outcomes in the home setting, but they lead to hospitalizations as well. For seniors, 20 to 30% of their hospital admissions are secondary to medication errors. Readmission rates for a patient who got just discharged from their hospital, went home, and then get readmitted, 66% of the medical errors that are known are due to medication. The whole goal of having this medication management program, and the reason CMS, or Center for Medicare and Medicaid Services, said we want all of our Medicare patients to be offered a free medication therapy management program if they're found eligible, is because the hopes would be this will then lead to reduction in medication errors. Our program has been published and we have data to support. We have seen a reduction in the medication errors, an improvement in our outcomes, and a reduction in the healthcare costs, not just total healthcare costs, but the out-of-pocket costs for the patients as well.